Hello, thank you for having me today to introduce my presentation. I'm happy that the Functional Aging Institute has managed to organize the summit despite the pandemic. Obviously, it would have been much better to be in Colorado today and see all of you in person, but safety first. My name is Danilo Contiero. I'm an advanced exercise specialist, exercise referral, karate instructor, PhD candidate, tutor in clinical exercise at the University of the West of Scotland. Before to start, I would really like to thank Professor Sipe and the Functional Aging Institute for the invitation and interest in my topic. And I would also like to thank Professor Maria Fiatarone from the University of Sydney who has shared with me some of her research for the following presentation. I apologize in advance for any mistakes that I may do during the lecture of my presentation, but as you may understand, I'm not a native English speaker, so I hope you forgive me for that, but I will really try to do my best. The title of my presentation is Physical Activity, a powerful drug for healthy aging. Do older adults like it? As you probably know, there are many studies that show the efficiency of physical exercise to prevent and treat several chronic conditions. Therefore, lately, physical activity has been compared to a real drug. At the same time, our population is aging very fast, and most of the conditions related to age can be treated and prevented with physical activity. I thought it was necessary to focus our attention on this population target to check how they could benefit from physical activity, and mostly if they like to do it. A lot of work has been done on the benefits of physical activity, but not much about how to involve older adults in it. We may have discovered and invented a very powerful car, but if people don't want to drive it, it will stay in a garage covered by dust forever. Already the ancient Greeks had understood that if we use parts of our body, they remain active and tonic, but if we don't use them, they rust, age, and get sick. They had a perception or intuition that being physically active was a kind of medicine, and they were right. But if we want to consider physical activity, physical exercise as a real medicine, we need to give it the same attention we give to other medical treatments, focusing on science-based application. We have to assess risk and benefits, and we have to adapt it to each patient, monitoring the outcomes. For which conditions can we use physical activity as treatment? Many studies confirm that physical activity is very efficient to treat pulmonary and cardiovascular disease, metabolic disorders such as type 2 diabetes, obesity, insulin resistance, muscle, bone, and joint disease as arthritis, chronic fatigue syndrome, osteoporosis, some kind of cancers, and depression. The picture in this slide explains very well what are the benefits of physical activity on the body and how these bring health benefits. In fact, physical activity reduces the abdominal adiposity, improving weight control. It improves coronary blood flow and cardiorespiratory function. It increases good cholesterol and reduces bad cholesterol and triglycerides, improves our psychological well-being and neurogenesis. In few words, practicing physical activity will improve the plasticity of the blood vessels and cardiac output, which means better blood and oxygen flow to the various organs and less risk of damages. But appeal. What we need to appeal for. According to the FDA, a drug is a substance recognized by an official formulary, a substance other than food intended for use in diagnosis, cure, mitigation, treatment, or prevention of disease, and able to affect any function or structure of the body. Except formulary thing, it seems that physical activity meets all the other requirements. But are we really confident of the effects of physical activity as treatment, or are we just paying lip service to the idea that exercise is medicine? We could actually physical activity for conditions we have no drugs available on the market, or to replace drugs that have important side effects, or to counter age-related physiological changes. So, prescribing physical activity has several advantages, as of working for conditions where there are no available drugs at the moment, of having fewer side effects, and to be cheaper and more accessible. But on the other side, being physically active requires a lot of motivation and effort by the patient. This is much more psychological and physical efforts than ingesting a pill. In this table, we can see all the suggested doses of physical activity for general health benefits that have been reported from 1970 to 2010. As any other drug, physical activity needs the right dose to work. Prescribing the right dosage depends from the clinical goal we hope to achieve and from the patient's conditions, as for any other medical treatment. And as any other drugs, it's important we don't abuse of it. Being sedentary is not healthy, but training too much may also lead to other risks as atrial fibrillation, cardiac damages, and coronary arteriosclerosis. Now, let's see in the specific how to use physical activity to treat some conditions as diabetes, depression, osteoporosis, and frailty. Let's start from diabetes. When we talk about, we will talk about type 2 diabetes, because type 1 diabetes is more a genetically dysfunction that can't really be helped by physical activity. But type 2 diabetes, which is the most common one, is very treatable with physical activity. The medical traditional approach to a patient with type 2 diabetes consists in suggesting the use of drugs, weight loss, and aerobic exercise. This is the most common approach. The problem with this approach is that weight loss brings also muscle loss. Aerobic exercise is not very effective at low intensity, and to gain high intensity it requires a lot of time, and often it's hard to achieve for people with other comorbidities as osteoarthritis or osteoporosis. And number 3, drugs intake works, but is related to weight gain and doesn't treat the visceral obesity that remains one of the risk factors for diabetes. The following paper, a prospective study of weight training and risk of type 2 diabetes mellitus in men, reports a new approach to the treatment of type 2 diabetes, not using drugs but using progressive resistance training, or PRT. The picture shows very clearly that people practicing minimum amounts of PRT had the lower risk to suffer of type 2 diabetes. Of course, if they practiced more than the minimum amount, results were even better. On the second part of the picture, we can clearly see that the results in the reduction of type 2 diabetes are even more significant when this is associated with aerobic training. In conclusion, we can suggest to engage in weight training or aerobic exercise for at least 150 minutes a week to reduce the risk of type 2 diabetes. Let's now consider exercise and depression. How exercise can help our mental well-being. Many studies have clearly confirmed the benefits of physical activity on mental health, and that physical activity is so powerful to take care of psychological distress that has officially entered in the guidelines of many countries as an effective tool to prevent depression, anxiety, and other psychological disorders. In Australia and New Zealand, physical activity is the first steps to treat depression. These guidelines make very clear the need to take physical activity seriously as a real drug. This is confirmed also by the study by Downey et al. From 1987. This is not a very recent study. And it's important to underline it because I want to make sure that you understand that the benefits of physical activity are not a new, fresh discovery that needs more studies to be confirmed. It just needs to be applied. We have proved all what we had to prove. In this study, we have a group of 40 women, 40 older women, affected by depression, and these women have been divided in three main groups: aerobic exercise group, not aerobic group, and a control group, where they had no guidelines about any kind of exercise. Results show that even if the amount of exercise in both groups wasn't sufficient to improve their fitness, anyway, it was sufficient to improve their mental health. So this suggests that also low doses of physical activity that maybe are not helpful to improve our physiological changes and fitness anyway can improve some kind of benefits on our mental well-being. In this other graphic, it was reported a study by Blumenthal et al. And this study describes a 4 months treatment with 10 months follow-up of aerobic exercise. And as we can see, people that treated depression with exercise not only had higher results than people that treated it with medication or a combination of both, but also people that treat the disorder with exercise had also the lowest risk of relapse. Great, but what is the dose of physical activity to treat depression? Let's say that to have a good results, physical activity should be of high energy expenditure, practiced at least 3 times a week. Please consider that the guidelines of the World Health Organization suggest only 150 minutes a week of moderate physical activity. If from previous slides we have seen what is the best amount of physical activity to treat depression, we have to answer what kind of physical activity is the best. The answer depends from the intensity. As you can see from the graphic, high intensity PRT brings the best results in the treatment of depression, both when compared to aerobic training, medication, or combination of aerobic training and medication. But the same high intensity PRT brings better results of the low intensity PRT. This means that the intensity is very important when we prescribe physical activity because the intensity changes the effects of the medical treatment on the subject. So it's easy to understand that to achieve a clinical goal, it's necessary to define the intensity and the kind of physical activity, not only the kind of physical activity. So it's not just, first of all, it's not useful just to say to someone, be active, it will help you in general with your health. No, we need to prescribe the treatment, the physical activity, according to the clinical goal that we want to achieve. And according to this, we need to understand not only what is the best program, the best kind of physical activity, but also which kind of intensity. Because otherwise, we may suggest the right physical activity, but will not have good outcomes because the intensity is too low. Now, exercise and osteoporosis has proved that strength and balance training can slow down or prevent the risk of osteoporosis in old adults. Recent studies have also proved that PRT is very effective to reduce the risk of mortality in people admitted in care homes after hip fracture. Hip fracture is a very common issue in elderly and is very hard to recover from it. Usually, hip fractures are related with a high risk of mortality, but PRT is able to reduce the risk of mortality in people that have experienced a hip fracture. These are other components that may help in the hip fracture intervention training. So just not rely on physical activity, but on any other uh, treatment that may help the recovery of the patients, and for example, a good nutrition. The importance of physical activity in the treatment of frailty and osteoporosis has been so undeniable that physical activity in Australia has been introduced in the guidelines for general bone health. People aged over 50 should practice PRT and balance training 2-3 times a week, and people with osteoporosis should practice high-intensity PRT and balance training to prevent further bone loss and falls. Exercise and frailty. What is frailty? We can consider frailty as the loss of muscle mass and muscle strength and increased fatigue. Up to 25% of 2 billion older adults in the world may be frail in 2050, and we have no drugs at the moment for frailty and the associated morbidities as poor balance, slow gait speed, sedentary behavior, sarcopenia. Sarcopenia is the loss of muscle mass and muscle strength, fatigue, poor endurance, loneliness, low self-efficacy, and cognitive impairment. The only thing we have to treat all these comorbidities is physical activity. Not all kinds of physical activity are effective in the treatment of frailty and sarcopenia. From the graphic in the slide, we can easily see that swimmers and runners, also if active subjects, have almost the same risk of contracting sarcopenia as sedentary people, while weightlifters have a risk almost equal to zero. This means that, as we said before, it's not enough to say to people be active. We need to understand what is the best activity for the clinical goal that we want to achieve. So even though swimmers and runners may have a very good aerobic capacity and fitness level, their activity is not efficient in the prevention of sarcopenia, while it is weightlifting. Contrary to what it was previously believed, strength and muscle tissue can also increase in elderly, following a proper PRT program, for example. The best results, as we can see from the graphic, are found when subjects combine exercise and supplements, but supplements alone are not enough. This is very useful to underline, and I think also in not only for older people but also for younger people in the field of uh, a diet. When a lot of people ask to me as exercise referral some program for weight loss, and the first thing that they tell me is that they haven't been able to lose much weight, even though they've been a long time on supplements, nutritional plans, and they haven't seen many changes in their body composition because they haven't added to the supplements and nutritional supplements the right amount of exercise. So if supplements as nutritional supplement may be very important for maintaining of our and improving of our muscle mass, alone they are not enough. Now, to be active in old age, PRT program should follow some guidelines, and these guidelines have been reported in the following slide. So, we should have a training period longer than 1 year. This training should be of high intensity, 70-80% peak, with slow movements. It should include rest between sets, and we should have at least 2 sessions per week, 2-3 sets per exercise, 7-9 repetitions per set. Now, because many adults and older adults feel more comfortable to train at home, some home-based training have been developed. And even if these programs are quite effective, they are not effective as gym-based training. This because of several factors. related also to tools and motivation. For example, old people that train in a gym, they have a trained instructor that is qualified and able to follow them and should understand what is their limit and push them over their limit of their perceived limit. But when these old people train at home, first of all, they don't always have the right tools to train. But also, when they feel tired, they just stop because they feel tired and that's their natural response to tiredness. They don't know what they could achieve because there's nobody to push them, that there's nobody that know that they can push a little bit more. And they don't even feel safe to do that alone at home because they think, what if something then happens to me? I'm alone. Can't ask even for help. So frailty is not untreatable, and rather than being a barrier to exercise, it is one of the most important indications for their promotion by healthcare providers. We can decide how to age, and this woman on the right, Ernestine Shepherd, is the proof. Now, in conclusion, if we want to prescribe physical activity as a medical treatment, we need to adjust it to the single case, use only evidence-based programs, record programs and outcomes, and as for any other medical treatment. Now, we will focus on cognitive processes and we consider healthy mind in a healthy body. This is a very, everybody has heard this before, as was very common to say by the Romans, mens sana in corpore sano, which therefore means healthy mind in a healthy body. But how much of science there is behind it? Again, old people had very good intuition, and to show why. Physical activity is not only a good drug to treat physiological disorders that affect our body, but also that affect our cognitive function. And physical activity is able to reduce the risk of cognitive decline up to 35%. There are many studies trying to understand how this exactly works, but there are different reasons. For example, physical activity increases cardiac output. This improves cerebral circulation and optimizes oxygen extraction and glucose uptake of neural cells. It also reduces inflammations and increases levels of the anti-inflammatory cytokine. Physical exercise also increases the level of anabolic hormones, particularly IGF-1, and decreases vascular damages and depressive symptoms. All these processes improve neurogenesis and cognitive function. And to not underestimate the increased social benefits of physical activity in the help of our cognitive function. Recent studies has also proved that that the volume of our brain is proportional to our VO2 max. So mostly the volume of the hippocampus. So the higher our VO2 max, our aerobic capacity or aerobic fitness, the higher our brain. Recent studies have also shown a clear connection between the level of IGF-1 or growth hormone and cognitive health. The higher the level of IGF-1, the better the cognitive function. How to increase our IGF-1? The answer is the same: physical activity. It's important to underline that these results are found to be true also in older people, leaving behind the myth of old age as the age of cognitive decline, where cognition couldn't be improved. The picture explains very well the results of a study involving older adults in a 12-month high-intensity PRT program. In the first box on the bottom right, we can easily see that people in the exercise group here had a high increase in the level of IGF-1 after 1 year training, while the group that wasn't involved in exercise showed even lower levels of IGF-1 than before. In the other box, we can clearly see that the same group of old people that was involved in the PRT program had in the PRT program and showed the increase of IGF-1 has also shown an improvement in the cognitive function, reducing the reaction time. Again, the problem is to understand what is the best physical activity to prescribe to improve cognitive functions. As we said before, this has to be considered case by case, always. But generally, we can understand that aerobic training is quite effective to improve cognitive functions. But the best training is when we combine aerobic and strength training. Therefore, we can suggest not to prescribe gentle or low intensity exercises for cognition, as they will have no significant effects. But what we can prescribe is exercise programs delivered 7 days a week of aerobic exercise with 3 days a week of resistance training. A volume of 45-60 minutes per session, sufficient to reduce body fat, insulin resistance, if this is one of the other goals. The intensity should be appropriate to the abilities of the subject. So the higher they can do, the better. The last part of my presentation, part 3, is focused on martial arts. It's named Martial Arts, Inspiration for Active Lifestyle in Older Age. As you have seen from my references, I'm a karate trainer and athlete. I used to compete in national and international competitions. I've been doing this sport for more than 20 years and I've trained in different countries. My personal experience in karate has shown me that this sport, as other martial arts, is able to create a community with rules, duties, and rights that really attracts people and let them stay together, in a sort of a private club. Other than that, this is a quite high intensity interval sport that requires a lot of mental focus, balance, and strength. When I started to get in the research of healthy aging, I noticed that all what the research was looking for was to develop an exercise program that was able to involve older adults in social activities, that was able to strengthen their muscles and balance to prevent falls. It really looked like they were just looking for karate, but they didn't realize it. They didn't know where to find it. A lot of research in the past had been focused on Tai Chi as a very effective exercise for aging. And if the results of Tai Chi on health are undeniable, unfortunately Tai Chi strength comes from the old conception that for older adults the slower the better. So this form of exercise, even if useful, may not be as useful as higher intensity martial arts. As we have seen from the presentation, in fact, the slower the better is wrong, and older adults need to be involved in more intense exercises. So I started to investigate what had been done related to karate, and what I found is that most of research just focused on cultural aspects of karate or technical ones, leaving undiscovered the topic of health and aging. I decided to investigate it myself, and results as expected have been amazing, both for the social and psychological components of these martial arts. I think that in the past, research has done two major mistakes in investigation of karate, and this is probably depends on the fact that researchers are not always expert of practice in what they investigate. Many researchers reported karate training. If this was enough for an experienced reader, it was not for me. I need to know what training, which style, because in karate there are many styles and each style has different training methodology. And more than that, as there is no protocol, the training changes from instructor to instructor. I realized that most of the research was done on old traditional hardish karate style that is very different from the modern one, the karate WKF, the most popular and the only one accepted by the Olympic Committee. I also realized that in the last few years, karate classes were attended by more older adults. Most of these people were ex-athletes that used to train in the past and decided to come back to follow their passion. At the same time, I noticed that instructors were unprepared in managing so mixed classes and teaching to older adults. Not all of them had a background in sports science, and the instructor diploma doesn't really prepare you to train older adults. I decided to bring my researches and thoughts to the Italian Karate Federation official camp, and these thoughts have been very well accepted. So, together with Master Salvatore Nastro, we have developed a protocol for all the karate athletes that will be delivered on a national scale. As I will show you in the next slides, I really believe that adapted karate may be the bridge able to allow older adults to pass from a sedentary lifestyle to an active one, not only in terms of physical activity, but also of social activities. It's not just the case that martial arts are one of the most activities that old people claim to join. As you may know, world population is aging and is doing it very, very fast. This is a challenge for our society in the way we think about old people and in the way we could involve older adults in social activities. When aging, more likely to suffer from functional loss and disability, sedentary lifestyle, and loneliness. These increase the public healthcare expenditure. For example, a 70 years old person with only one functional limitation has a cumulative healthcare expenditure of about $145,000 until death. Falls are one of the major challenges for public health. One third of the 65-year-old population will fall each year. Falls are not only dangerous, but are also associated with psychological stress related to fear of falling, or FOF. In fact, fear of falling pushes older people to stay at home because and is a strong limit for social interactions. It pushes old people to be sedentary, and consequently it increases the risk of falls and poor quality of life and loss of muscle mass. To prevent falls and sarcopenia, there is no pill. The only way is to practice physical activity, as it is the best way to reduce the risk of other common age-related diseases as type 2 diabetes, cardiovascular disease, osteoporosis, and balance problems. We have a solution, but what is the problem? Why older adults don't want to join programs? In fact, older adults, fewer than half of older adults invited to join physical activity programs, refuse the opportunity. Why? What is wrong with that? Answers may be different, but I'd like to underline social prejudices and motivation. Let's start from the first. There are many social prejudices that consider old age as the time of frailty, where exercise can be of high risk for older adults' life. This is even worse when the exercise is of high intensity. Many of us may have heard from someone say to his father, or they may have said to his older father, that where are you going? Don't go running. Don't go to the gym. You are too old for that. It's dangerous. Prejudices are completely opposite to what scientific research has proposed in the last years. Research has shown that a safe PRT program is perfect to improve muscle strength and growth in older adults, improving their quality of life. This brings new information. Aging is not necessarily the age of frailty. Our body, our muscles are still responsive and can be trained, improved, and can become strong. We can still be independent. The second problem is motivation. Why older adults should join the physical activity program? What will they gain from it? Selling only the health benefits is enough? I'm not sure. In fact, what older people are looking for in elderly is learning new things, meeting people, improving confidence and mood. They are looking for social approval and family support. The physical activity programs need to include these points if they hope to involve this population target. As an example of the exercise programs that have been previously planned for the adults, we can see Otago. This is a very popular program for home training. It is one of the things that make it popular, as it can be done by older adults that are unwilling or unable to leave their house. Also, if Otago is very effective, as we have seen before, home training is not as effective as gym training or supervised training. And furthermore, these home training programs don't involve the social component at expenses of the social needs expressed by elderly people. So, how can martial arts help? Why they are different? Well, martial arts are very popular around the world, showing that there are dojos a bit everywhere and they are quite financially accessible. Dojos are gyms where people practice martial arts. Martial arts are a philosophical component or code of conduct that seems to place great respect in the instructor or in the older adults, not only the more experienced ones. This really fits with the needs of older adults that we have seen before, as improving their confidence and social approval. Martial arts are also one of the activities that older adults claim to enjoy, and being practiced in classes or small groups, it helps to be socially active. Martial arts have a peculiar aspect based on empathy. It's very important to learn to establish empathy with the opponent when sparring or training, and martial arts have resulted to be very effective to decrease osteoporosis and falls, and to improve growth of muscle strength. But if someone has tried martial arts before, it's likely to try it again in old age. But if one has never done it before, there may be some questions and fears about it, mostly caused by misconceptions of martial arts, mainly movie related or related to social prejudices on aging. For example, the slower the better, and the lack of a protocol and poor commitment in promoting courses for elderly. In this picture, we can see on the left what usually people think older adults can do, and on the right what older people can really do. So the difference in these two pictures is that on the right side we see some older athletes, but still athletes that train every day very hard, compete, travel the world, get socially involved. On the left side we see some old people trying to practice some kind of martial art. Uh, we can see not very high intensity in a very easy class, and that's totally fine. It's totally fine if older adults don't want to be engaged in competitions and don't choose a competitive sport in their late age. But the thing is that we need to understand that it's up to their choice, and they need to understand that they have a choice. So older adults may be competitive if they want or not, but if they decide to do so, we shouldn't stop them because their body can be trained. Their body is still responsive, and they need to know this in order to make the right choice. Let's now check what older martial artists say about their lifestyle and about martial arts. In the next slides, we will see some outcomes of interviews extracted by the paper Dojo and Traditional Martial Arts, a social community for physical activity and health prevention in later age. In this paper, I have interviewed some expert older martial artists competing in the specialty of Pumse from Taekwondo. The first interview is with a 62 years old Taekwondo instructor and active athlete of the USA national team of the Pumse. She's a world champion, and she says that it is a way to connect with the world and with people. Martial arts help people to be stronger, physically and mentally. It helps a lot to be conscious of our true abilities and skill, above all in older age. This is very important to gain confidence in yourself and in your body image, above all when you are old and social prejudices describe older adults as weak. Gaining confidence, having better body image, travel, and be socially involved are all the key points that we have seen before in the slides related to older adults' needs. All these needs, according to the respondent, are very well satisfied by the practice of martial art. The subject to be interviewed is a 70-year-old Taekwondo instructor and scientist in neurology. He says that martial arts techniques and movements. They activate a lot of brain function and different muscle chains. So he confirms the possible positive effects that martial art may have on cognitive functions. Last participant, uh, always from the USA Pomsei team, she is an active athlete, multi-awarded the champion in national and international competitions. And she says that in the USA they refer to dojang or dojo as a community or family, and that this has played a central part in her social life. This really fits with the needs expressed by older adults of finding with the needs expressed by older adults to find a role and a space in the society. So participants have underlined according to their experiences and views the main benefits of practicing martial arts that are being socially involved, fighting social prejudices on age, gain self-confidence, improve physical and cognitive functions, being part of a community. This is what older adults were asking for. This is what we should give them, what we should include in our physical activity program that we decide to deliver and to adapt for them. In conclusion, the strong need of belonging and stability in the later years of life seems to be well satisfied by the practice of traditional martial arts. Most of older athletes seem to train not only for the fitness, but for the social context that they find in the dojo. Dojo is not only a place where practicing traditional martial arts, but a micro community where older adults feel physically active, alive, and socially engaged. Martial arts could be a popular physical activity in old age with strong social empowerment. Therefore, I really invite the different sport federations, not only karate federation, to start to develop some protocols for older adults. Because older adults maybe want to be involved in sport, but not very often they find the chance, or very often they find the right instructor that is qualified to do so. At the same time, I also want to suggest to experts here today that we should really consider physical activity as a treatment. We should really try to involve it in the clinical environment. As I said before, of course, I'm aware that taking a pill is much easier than physical activity. But at the same time, we should consider physical activity as a way to improve not only the physiological benefits but the quality of life. For example, older people know that today they can live longer, they have bigger life expectancy than before. But sometimes when they go to doctor or they refer to an exercise professional, they always don't feel very motivated to be healthier because they think, okay, you want me to live longer, but is that worth if I'm not able to socialize, if I live alone, if I'm not able to be independent, why should I do that? I lived my life, I had a job, I'm retired, I had a family. Why should I put much effort in this to live longer but alone? Well, if we give them a purpose, a reason to live, the physical activity will follow. If physical activity in fact will be for them an occasion to meet other people of the same age, to socialize, to gain new friends, they will not feel alone anymore and they will feel more independent. At the same time, they will train and they will discover that their body is still responsive and can be trained to be functional. to be independent and to practice daily activities as any other person. So they will understand that they can be able to run, play with their granddaughter, grandchildren, and live their life, not only longer but better. So therefore, I really encourage you today to start to think about physical activity in a more complex way, not only as a medical treatment that is good for physiology, but as a treatment that is a therapy. Therapy that can help people to have a different perspective on their life and to improve their quality of life, above all in old age. So we cannot stop aging because it's a genetic process, but we can definitely decide how to age. Thank you very much for your I really thank you for your attention, and I hope you have found this presentation of interest. If you have any comments or any questions, please do get in touch and I'll be able to answer. I hope to see you in person, maybe to next Aging Summit, and I hope you have a good rest of the day. Thank you very much.